in the upcoming INICET exams also. Okay, so you guys must have revised, and whoever have not revised also, not a problem. You listen to the class and we will do it. So the first one, see the first question. Excuse me, I'm very sorry. Sorry for this interruption. So, which of the following is not a dimorphic fungi? Okay, so this one, you know, mycology, one of the popular topic examiner likes the most, if you ask me, is this topic only. Which one? Dimorphic fungi. So, dimorphic fungi, the meaning itself, you know, it is existing in both yeast form and the mold form. Yeast and mold, you have two forms, both the yeast and mold form, right? So, the shortcut I always told you to remember for this dimorphic fungi is, to remember it like this, easy. Hit, blast, cock, paracock, cock, paracock. Then a spot and pen, right? These are the shortcut to remember. Okay, we'll revise it now. So you can remember it in classes. We discussed many times, I know. So hit for histoplasma, blast for blastomyces, cock for coccidioides, right? Coccidioides, and paracock, paracoccidioides, right? And spot for sporothrix, pen for penicillium. These are the important dimorphic fungi, right? These are the dimorphic fungi, you know. So now in dimorphic fungi, once again, yeah. So, you know, so see the option you're seeing here, histoplasma we have, cock we have, blast we have. Which one we don't have? Cryptococcus we don't have. So easily, I told always examiner allowed to ask this cryptococcus. Cryptococcus is not a dimorphic fungi. It is a pure yeast. In cryptococcus, it's a pure yeast, you know, most common cause of meningitis in HIV patients, that you know very well. And you know, it's the only cryptococcus is the only capsulated fungi, right? Capsulated fungi. Okay, that's the only capsulated fungi. Capsule is positive. And what else we can do? The best test is always the ICT, immunochromatographic test, or latex agglutination test we do for cryptococcus. I am not going much deeper. And one more thing is India negative staining. You do negative stain for this cryptococcus capsule. That is negative people are Indians and India Inc. and the Nigerian Negroes. And that's the shortcut we have given to you. So you know that's for cryptococcus. That much only. And amphotericin is a drug of choice. Finished. Cryptococcus over. Now, in dimorphic fungi, the most important thing is the diagram. We are told, repeated many times, right? These four pictures we're going to discuss now. One question, surely you can expect this. Okay, I'm seeing frequent trend. Dimorphic fungi is examiner's favorite, and they always ask one question from the diagram. So, first one, you guys know it. Sorry, I want to ask you guys and get the reply, but it will take a lot of time. We have short time, no? So later I'll maybe discuss. Okay, you can write in chat doubts. I'll clear later. The first one, what you're looking is, if I'm saying histoplasma, then you're right. This is the histoplasma. Histoplasma, this is the yeast form, and the other side which you're seeing is the mold form. In yeast form, you can see what you're seeing, intracellular, that is inside the macrophage. You're seeing a tiny budding yeast cell, tiny, okay, tiny narrow budding, tiny narrow budding yeast cells. Okay, you see, are you seeing? This is the macrophage, and inside you're seeing very small, tiny budding yeast cells. This one, all those things. Okay, so that picture comes, that is your histoplasma. Or sometimes they give you the mold form. You give the mold form, what you're seeing a tuberculate macroconidia. You're seeing a tuberculate macroconidia for histoplasma, right? Histoplasma. And you don't forget, histoplasma is very much like your TB. So here also tuber, also TB, something that sounds like a TB. So clinical picture of TB, history of bad exposure, and that is histoplasma, which is also called, I know you guys must have thorough with that, Cave's disease, also called as the Darling's disease. Okay, Darling, Cave, all those names. I mean, Ohio disease or whatever. Okay, so those things. That's for histoplasma. First one. Second one is your blastomyces. The second picture, what you're seeing, this picture, if you get, even if you forgot, also don't need to worry. See, how does it look? It looks like a figure of 8, right? Figure of 8. So that's also figure of 8, also called broad-based budding yeast cell. Because you see, this is broad, right? Broad-based budding yeast cell. Histoplasma was narrow. Your blastomyces is broad-based budding yeast cell, right? That's all. So B for blastomyces, B for broad-based yeast cell. So this question you shouldn't make mistake. Okay, it's unforgivable if you make a mistake because you already have a clue. 8 is looking like a B, and everything is B here. Broad-based budding yeast cell. Okay, that's it for blastomyces. Nothing. It's a Gilchrist disease, otherwise called as Gilchrist disease. Nothing much they want to ask. You have only yeast form in blastomyces. Mold is not important, so you can omit it. Third one, the other expected question is third one, cock. Cock is, when you say cock, it is the coccidiosis. Coccidioides. Coccidiosis, we remember, if you remember, I told you to remember a cock, right? A cock which is standing on a barrel, and where it is traveling? It's traveling on the valley. It is going to the desert. Right? Desert. And what is this cock's name? It's called Arthur. Arthur cock. The shortcut in class I gave was this only. Arthur cock, right? Cock. Why cock? Coccidiosis. Why Arthur? You see the typical arthrospore, which is barrel shaped. Barrel shaped macroconidia. This arthrospore or barrel shaped macroconidia is very characteristic for coccidiosis. So which cock? Arthrospore, barrel shaped. This is the barrel. On the barrel, it is standing and going where? Through the valley to desert. Because what is the disease name? We have a valley fever. We call it as the disease name is called valley fever. And the desert, because desert rheumatism. Okay, fast. We are going fast because it's a revision session, right? That's it. So, and then this one, don't forget the sperules. Sperules is the yeast form. This is the yeast form, which is not much asked, but the mold form is frequently asked. The mold form of coccidiosis is arthrospore, or sometimes rectangular they can give, but basically arthrospore or barrel-shaped macrocodia. Finished. Okay, for coccidiosis. Another one is paracoccidiosis. If not coccidiosis, the examiner's favorite would be the paracoccidiosis. In paracoccidiosis, yeah. So, what about in the paracoccidiosis? In the paracoccidiosis, sorry. Okay. Give me a second. So, in the paracoccidiosis, I'm sorry. Yeah. In the paracoccidiosis, this is paracoccidiosis imitis. Okay. In paracoccidiosis, very, very characteristic is what? Very, very characteristic is what? You guys know. See the picture. How does it look? It looks like Mickey Mouse appearance. So, Mickey Mouse. Your yeast form is otherwise called Mickey Mouse sign, or look at this. This is a cartwheel or pilot wheel. This is your yeast form. Both are yeast form only. It can be like this or it can be like this, which is called cartwheel. Cartwheel or pilot wheel or sailor wheel. Any wheel. Totally there should be a wheel. That's it. Okay. Paracoccidiosis. That only you have to remember. Okay. Paracoccidiosis, Mickey Mouse or cartwheel or pilot sailor budding yeast cells which you are seeing. That's it. Okay, this much for your paracoccidiosis. Here mold form is not important, paracoccidiosis. Then other one is this one. Okay, you're seeing what? You're seeing a beautiful what? Paintbrush appearance. Okay, you're seeing a paintbrush appearance. Just a second. Yeah, sorry, I have to decrease this. Sorry for this small delay. I want to take this the other side. One second. Okay. Am I visible? Doctors, am I visible? Okay. Okay. If you say visible, then good. Okay. Thank God. Yeah, now it's better. Okay, fine. Yes, so this one is penicillium. The next one is penicillium. Penicillium, you're seeing, okay, penicillium we told. I'll always told that this is in penicillium, what you have? You have the paintbrush, or what is this? Broomstick. Paintbrush or broomstick appearance mold form, right? Mold form. And this one, the yeast form is called sausage shaped budding yeast cells. Okay, it's just looking like a sausage shaped budding yeast cell. This is your yeast form. That's it. Okay, yeast form for penicillium. That's it. Okay, that's it. Done. Of course, sporothrix we are not going to add here, but again, sporothrix is also here, and sporothrix you characteristically know what it is called. It is called as the Rose Gardner's disease. First of all, Rose Gardner disease. So usually Rose Gardner get what they get, thorn prick, right? Thorn prick. When they get a thorn prick, you have the lesions along the lymphatics, right? Along the lymphatic. That is also frequently asked. Along the lymphatics you have, and then you make when you see the yeast cell, what you will see? You will see a special, beautiful what body? As you call it as an asteroid body, stars, because we always remember Rose Gardner at night time, he will be seeing the stars. He will be seeing the stars, right? And what he smokes? He smokes the cigar. So, cigar appearance. Cigar appearance, asteroid body, cigar appearance. In the mold form, because the name itself is a Rose Gardner, you see a typical what? Flower, rose flower like conidia. Rose flower like conidia. Rose flower like conidia. That's it. This much only you should know in the sporothrix. Treatment is heteroconazole. We know very well. Okay, that's it for sporothrix. So this among 6 of this dimorphic fungi, one diagram is expected. So don't make mistakes, doctors. You will get it correct. Okay, sure. Now, next question. Next question. An immunocompromised patient, look at this question, immunocompromised patient, uh, okay, I'm seeing from the previous chat anything. Okay, fine, good, no problem. Okay, look at now this question. An immunocompromised patient, HIV, okay, presents with the, what are the symptoms he's coming with? He's having the dysphagia, odinophagia. So esophagus has some problem. And then during a GIT endoscopy, they have taken a white plague was seen. White plague, the white thing comes to my mind. The first thing of the fungus which come to my mind is Candida only, esophageal candidiasis. Then a biopsy was performed, a microscopic examination. So already the clue is given for you already. The clue is already given. What clue was given? The clue is already given. Excuse me. Yeah. Sorry. The clue is already given for you. That is your white plague. The white plague is and the HIV patient white plague, that is pointing towards the Candida. Candida, you know Candida. Candida, we always say you should know microscopy of Candida very well. This is oval shaped budding yeast cell. Oval shaped budding, BYC is budding yeast cell, and it is gram positive. Because I'm drawing purple color means the idea it is a gram positive. You know bacteria only we say gram positive, gram negative, and even fungi, this one, your crypto and Candida also gram positive. There is no gram negative fungi. There's only gram positive fungi. So you have this typical oval shaped budding yeast cell. So you know that Candida also not only budding yeast cell, it forms a pseudo hyphae also. So see the option, yeast cell with pseudo hyphae is a correct answer. Acid burst facilla is a TB. There is no TB. Candida, esophagus TB, no any link. Branching septate hyphae, that is Aspergillus. Aspergillus has nothing to do with the esophagus. That is out, right? Out. Multinucleated giant cell, you know. Multinucleated giant means herpes, herpes simplex virus or herpes zoster virus. Even measles, okay? Measles, you know, Warthin Fenkittli cell. Those are the multinucleated giant cells. Nothing to do with this. So you already got a clue. Very nice clue, esophagus, Candida. And second one, if you're doing microscopy, is a pseudohyphae. So this question also, making mistake is not allowed, okay? So Candida is like this. Same question, if a patient is something related to HIV patient, meningitis on CSF, what do you see? If a question comes like that, there it is round shaped. You see round shaped budding yeast cell with capsule. So that is what? Cryptococcus. That is also yeast. That is cryptococcus. That is yeast. Okay, that's all. So this is the important thing you have to do. Okay, now give me 1 second before next question. There is many chat box. Yes, very good, doctors. Dr. Karthik Ji, all of you answered very, very well. Excellent, excellent, excellent. I'm so happy. Only thing is that we don't have time, so I can't check everybody's answer. Okay, so don't mind if I don't reply. Okay, at the end again we'll discuss. Okay, no problem. Okay, now good, very good. So these two, Candida and crypto, another expected question for HIV patient. They can ask you either esophageal candidiasis or meningitis, a capsulated. If they ask a capsulated fungi, that is your cryptococcus. Both are yeast and yeast, right? Okay. So this is a typical picture. You can see this is the Candida. Candida, exactly you're seeing an oval shape. So if in a gram stain, if they give like this, please don't confuse with your Staphylococcus aureus. Staphylococcus aureus is little bit smaller, and you know what? Staphs, what they eat? Grapes, right? Grape-like cluster. So that is totally different story. That is bacteria part. In Candida, it's like this, okay? It's bigger than this. You see, it's big. Candida is bigger than Staphylo. So don't mix in the picture, okay? So this picture you can expect. And this is your chlamydospore. They call chlamydospore, which is again characteristic for Candida only. Sometimes they haven't asked. Sometimes these people are crazy. If they ask you something like this, chlamydospore come, that's also Candida only. And this one, you know, this is the pseudo hyphae, but basically this one of you are pseudo hyphae, but also this is called, you know, that germ tube. Okay, germ tube. Please don't forget germ tube test you do, which is called Reynolds-Brody phenomena, right? Reynolds-Brody phenomena. It's characteristic of which species? Candida albicans. Candida albicans. Characteristic for Candida. Of course, dubliensis also. Dubliensis, but very much for Candida albicans only. A germ tube. Okay, germ tube test which is positive for Candida. This much is more than enough to remember. Okay, fine. And of course, this is Candida. If you picture is like this, this is the sabrodextrose agar. You're getting a yeast means paste-like colony. And important question is sabrodextrose agar. Please don't forget the pH. 5.6, okay, 5.6. Sabrod is yes. So here also you see it's like 5.5 or 5.6 like, okay. Don't forget that can be asked, question can be asked. And please remember, you have cycloheximide and you gentamicin, common antibiotics to inhibit the other bacteria and other saprophytic fungi, which is not needed. Okay, so that is also added in STA. Some of the special STAs, cycloheximide, gentamicin is added. Don't forget. Okay, that's also one question you can, in case you know they ask. And this is this colorful. When you see like this rangoli, different color, that is called chrome agar. That is for speciating the Candida. For Candida speciation. For Candida speciation, you can do chrome agar. That's all. Okay, this much only you have to know. Treatment is fluconazole. Okay, so that's all. We have done with the Candida. So Candida is over, crypto is over. We did a very, and don't forget the crypto, which bird it is? PGN. Okay, don't forget the PGN bird. I think we have question on that, no problem. Okay, still it's better to know now itself. So we are going to next question. Look at this question. A lung biopsy from the post-transplant. Okay, a lung biopsy was taken from the post-renal transplant patient. Okay, which shows infection. And which of the stain is least useful in the diagnosis of this organism? So they have taken a lung biopsy and given to you. Some staining was done. Okay, what I'm seeing in the stain, I am seeing something like a hyphae. I'm sure exam you'll get a better picture. Okay, you'll get a better picture. But see, I'm seeing this beautiful hyphae. Okay, when I'm saying this, you don't worry about all the small cells and all. Don't like that. Okay, you look for something special like a hyphae like that. Okay, hyphae. So hyphae means itself it is a fungus. Hyphae means when you see a hyphae, that is a mold fungus mold form of the fungus. So when the mold form of fungus is coming, we know these special stains. Actually, when you want to talk shortly about the stain, the most common stain which uses LPCB. You know that LPCB, which is blue color, most commonly used stain is LPCB. And of course, we do KOH mount. Okay, apart from that, special stain. When you talk about the special stain, we repeatedly told we use Gomori, methenamine silver, impregnation stain. And then also we use which PAS and hematoxin and eosin. We commonly used stains. Okay, and chalcofluor white, the fluorescent stain, chalcofluor white. Chalcofluor white also can be a question. It is the special fluorescent stain for your fungus. Everything is there. Fine. Fontaine, now confusion would be for you, Congo red and Fontaine Mesana. No need confusion anymore because Mesana M for melanin. Any melanin containing structure, especially melanin containing fungi. Usually Cryptococcus also one of the melanin containing fungi, but we have other things, the Demitaceous fungi we have, okay, melanin. So this is also a fungi. Congo red, definitely not. You know very well that is a Pathology form, that is for pathology for amyloid. Okay, for amyloid. So that is your answer. Okay, that's it. So no confusion, right? So remember all this thing. LPCB is lactophenol cotton blue, most common stain, okay, which gives blue color to the fungi. Rest these things give pink color. And when you see anything black, that is gomori methylamine silver. See any silver, black color. Okay, that's it. So this much only for the stain. So this much only is there. You don't have to worry. Only this much stains we have in fungi. If you know this, then you're done. Your fungi stain is easily done. Okay. And these for biopsies we're using. Okay. So stains are important. So don't make mistake in the stains. So fungus stain is one repeated question. Okay. Examiners love this. Okay. What about, yeah, this is exactly what I mean. This is the gomori methylamine silver, GMS. You see anything black, that is silver stain. Okay, that is silver stain. And these are the hyphae. What you're seeing here, these are the fungal hyphae. You see here, anything pink you see, that is periodic acid chef or hematoxylin eoxin. These two stains, they give somewhat pink light color like this. Okay, that's it. Simple. Okay, no any doubt in this. Okay, very good. Now, next one. We are moving to next one. This is calcofluor white. Your calcofluor white. Calcofluor white picture hasn't, they asked the question calcofluor white, but they never give the picture yet. So if you see anything white shining like this is a fluorescent stain for your, which one? Fluorescent stain for your fungus. Then what I'm going to ask you, please tell me the fluorescent stain for TB. So I know most of you must be answering, that is auramine and rhodamine. We discussed many times in the class. So Mycobacterium TB. So no mistake, right? MTB, Mycobacterium TB. So no mistake. And of course, malaria, we repeatedly told. We told what? Give to your friend Motu. When Motu gets malaria, what we have to give? We have to give orange, acridine orange. Moto is what? Kawamoto technique. Okay, I'm going fast. We all discussed this many times in the class. So this is another. You can expect this question. And this one is your negative stain. Another stain for fungus is the negative stain. Of course, negative stain is only for capsule. So, you know, the only capsulated fungi in microbiology is Cryptococcus. In fungus is Cryptococcus. I mean, in the, not mycology, not microbiology. In mycology, in fungus is the Cryptococcus. So, you see the capsule, the background is dark and the capsule is stained. That's it. Okay. So, Cryptococcus meningitis, most common cause of meningitis and HIV patient repeated many times. This one, which is penicillium, when you see a blue color stain, that is your lactophenol cotton blue. That's it. Okay, stain. These are the stains picture. If they give any of the picture and tell which stain is used or whatever they give, don't make mistake. Okay, this is a typical broomstick we already discussed. Penicillium. Okay, penicillium. That's it. Okay, right. We are going to next question. Another examiner's favorite question we already discussed, but also again repeated, multiple times repeated. If you see, so here the clues are given very nicely. See. A Gardner. First disease, Gardner. My mind will think only sporotrichosis. That is, I'll think like that only. Black ulcer on his right upper arm. That's okay. Axillary lymph node. Second clue. Okay. Axillary lymph nodes are enlarged. Okay. That is also second clue. I got it. That is sporotrichosis only. Aspirate from the lymph node shows elongated yeast. That is what? That is elongated yeast. Okay. Elongated yeast. Let's keep there. And the mycelium shows the aspirate and grow 22°. That is dimorphic fungi they want to say. And this is the one they have seen. Mycelium they have seen. The picture is given. Okay, very good. So this is the one I thought, rose-like conidia. Okay, rose-like conidia, macroconidia is there. And your elongated is the what? Sausage-shaped yeast. Okay, sausage-shaped. And you see the lesion along the lymph node. So that's your sporothrix. Do we have a sporothrix? Direct, straight answer. That's it, sporothrix. One more thing, if they want to ask, they can ask you what? Asteroid body. They can ask you as an asteroid body. Where is? Once again, yeah. You call it as the asteroid body, right? And that is phenomenon is also called Splendor-Hopley phenomena. Don't forget, Rose Gardner is having what bike? The gardener is having what bike? Splendor bike. He has a Splendor bike. He smokes the cigar. He looks at the stars at the night time. All these things, these words, cigar, star, and these things, splendor, all things comes simply sporotrichosis. Okay, sporotrichosis comes under, one second. Sporotrichosis You know that Sporothricus comes to subcutaneous, right? It comes to subcutaneous mycosis. That's it. So rest all out. These are dimorphic fungi and blastomyces dimorphic fungi. So it is not coming here. You can rule it out. Okay. So this is all we discussed. This is the typical lesion they are talking. Rose Gardner, row of ulcer along the lymphatic. Just this word, if you have, you think about rose Gardner sporotrichosis. That's it. Okay. This is your typical beautiful asteroid body. Okay. Who is having? Your rose Gardner is having asteroid body, and what he's eating? Sausage. He's eating elongated sausage yeast. Okay, sausage yeast. Okay, just for clue only, he's not eating sausage. Okay, so these are the typical words you have, and of course, you know the drug of choice is atraconazole for the sporotrichosis. Also, sometimes potassium iodide is used. Okay, pot of. Okay, he takes pot also. Right. Okay. Now, next question. So, this is another question. Still, if you are in fungus only. Walking barefoot, okay, walking barefoot in the soil. Walking barefoot in parasite, we discuss something, will talk that also, but something like this, walking barefoot comes means, you know, the disease started in Madurai only. Disease started in Madurai. People who go into temple, they were not wearing footwear, they were walking on the thing. Happened in Tamil Nadu. Of course, it's in Tamil Nadu. So Madurai means itself, automatically you have to think about mycetoma, Madurella mycetoma. That is more than enough for me clue. So let's look here. You already got it. Madurella mycetomatous. Okay. So Curvularia out, coccidiosis, aspergillus, no link at all. So which of the following is transmitted barefoot? Mycetoma only. Mycetoma, you know, this is a typical mycetoma, right? This is a typical mycetoma. There is a swelling, there is a sinus, and there is a discharge with granules, discharge with sulfur granules. These are the sulfur granules. That's it. Okay. So that is, we have actinomyces and we have the eumycetoma and we have actinomycetoma. Actinomycetoma is bacteria. Eumycetoma is pure fungi. Okay. That's it. That is another thing. We are not going to talk that now here. Yeah. So this you remember. Okay. This is the thing. Right. So you know, no. So this is the mycetoma. Please don't forget. This is a typical picture you're going to have for mycetoma. Sorry. This is a typical picture you will have in mycetoma. So that's it. This much you remember. Okay. Typical. Fine. It's bacteria actinomycetoma. If it is eumycetoma, it is fungi. Okay. That's it. So I'm not going to talk that. That is easy part. Yeah. Next one. Which of the following is true about Cryptococcus? Told no, Cryptococcus question will definitely come. So we already discussed many things, but let's see what is left here. Okay. Let's see what is left here. Yes, doctors all have answered very, very well. Very good. Okay, good. So true about which is following is true about the Cryptococcus. Seen in the CD4 less than 500, is it true? Not. Okay, we'll talk about that. Anyway, this is wrong. This option is wrong. Extrapulmonary cryptococcosis is AIDS defining illness. Is it extrapulmonary? Yes, correct. That's what meningitis. They mean to say meningitis is an AIDS defining disease. Yes, it is correct. Gatti is associated with a bird? No, not Gatti. We are with a bird which is associated with the pigeon bird. The one which is associated with the pigeon bird is the Cryptococcus neoformans. Gatti, we have two T, TT. So which tree? Gatti is associated with the tree. Which tree? So this first option is wrong. Second option is wrong because Gatti is associated with the tree, eucalyptus tree. Eucalyptus tree, you have a question. Eucalyptus tree. Only your Cryptococcus neoformans is associated with the pigeon bird, not the Gatti. Gatti, T for tree, eucalyptus tree. Okay, right. Now, pathogenesis species are urease positive? Definitely yes. So, which is true? So, only your 2 and 4 are true. 2 and 4 are true. Others are wrong. Okay. So, now how to say? First of all, you know that HIV, the CD4 counts are very important. So in HIV, most diseases are happening when your CD4 count goes less than 500. When you talk about less than 500, common things you should come in your mind is TB, Kaposi, okay, Kaposi, herpes zoster. I'm talking about herpes zoster. Okay, and of course, TB, Kaposi, herpes zoster, Candida, the basic Candidas. Okay, basic Candidas. They all will come in the CD4 less than 500 category. But most important is less than 200 category. In less than 200 category, so though some books say 100, some books put it into 100, some 200, but let's stick to 200. Most Indian books for 200 only. The 200, the most common one is first of all toxoplasmosis. Second one is cryptococcus, less than 200. Third one is pneumocystis cerevisiae. Pneumocystis. These three are commonly asked questions. When your CD count goes more than 200, you are in very high risk of getting toxoplasmosis. Okay, toxo, crypto, pneumo, all dangerous diseases. And of course, when it goes CD4 less than, when your CD4 is less, CD4, sorry, less than 50, two important diseases. One is your CMV, other one is your MAC. MAC is a microbiome avium intracellular, which is causing TB. Microbiome avium intracellular complex. These two. Okay. Of course, there are some rare. You have other some rare things so that they will not ask this JC, I mean JC penny virus, JC virus we call, but CMV MAC is very common, less than 50. So that is, this category is very important from first point. And extrapulmonary is definitely because the primary organ is lung. When it is HIV patient, it goes to the brain and cause meningitis, right? That is also important. Primary is always lung. For all dimorphic fungi also primary is lung. For Cryptococcus also it's lung only. Only when immunity goes down, it spreads everywhere. Okay, that's it. So pathogenic species, urease positive, Gatty told. Okay, that's much only. This much of a crypto. Crypto we are thorough. So crypto highly expected question, don't make. And treatment. What are you going to give the treatment? Treatment is, of course, because it's very severe, any fungal severe infection, amphotericin B, even for your mucormycosis, if you remember, right? So amphotericin B, any severe amphotericin B. So this we already told. This is your CSF sample, which you have done India ink, that is negative stain picture. This is a bird seed agar. Okay, they might ask you this also, bird, which agar is used for crypto, bird seed agar. How you remember? Because crypto means it's a PGN, PGN means bird. So I'm going to remember it that bird seed or any seed agar, Niger, sometimes they give you Niger seed agar, bird seed agar, whatever they give, doesn't matter. See, it looks brown like this, okay? Because they produce melanin. Your Cryptococcus also produces melanin pigment. Don't forget, okay? Melanin pigment and urease positive are two important characteristic feature of your Cryptococcus. Melanin positive, urease positive. That's it, okay? That's all. So this is for your crypto. So crypto is very clear. Again, one more, this question also came. See this, now I think you can answer yourself. Okay, which of the following is true with respect to the organism shown below, right? So they've given a just organism they've given, you see a capsule, that's it. All you're seeing is a capsule. So that means when you see a capsule in the fungus, it is crypto.